Dr. Shel, would you please give us an overview of your practice and, importantly, what brought you to this commitment?
Absolutely. Having practiced traditional OBGYN for well over 10 years, I truly loved it, got satisfaction from it. However, after doing it for a long period of time, what I was finding is in the midst of trying to see anywhere from 25 to 40 patients a day, I was losing what I actually went into medicine for, and that was to take care of the person, to take care of the individual, to really look deep inside, not just write prescriptions, not just deliver their baby, do a hysterectomy, and move on and see them the following year, but really understanding the human aspect that goes beyond the person that you see and a chart that you see. So what I discovered is there's much more to taking care of people than writing prescriptions, and also much more than just diagnosing something based on a checklist. What I discovered then is I would need to do this on my own. This is something that is not taught in medical schools. This is not something that is supported by pharmaceutical companies or anything of the sort. So I went and got retrained, and what I did is decided that I was going to practice medicine my way, and I was going to give patients what they truly need and are seeking, and that is total, complete health, where you put together the entire mind, body, spirit element. So now what I do in my practice is I do not accept insurance. I spend a very long amount of time with my patients. In the initial visit, where I used to spend about 10 minutes with my patients, now my average time with my patient is 45 minutes to an hour. And I truly get to know the person behind that chart and behind the facade that you see on the outside. In my office, we always have 2 boxes of tissues. It's a running joke in my office, one for the patients and sometimes one for me, because we really share a lot about life. And as an OB-GYN, I feel that I have the expertise from traditional medicine to impart that allopathic component when it's needed. But what I've discovered that a lot of things can be prevented by using bioidentical hormone replacement, managing and balancing their hormones, using nutrients, using supplementation, testing their nutritional levels, not just treating everybody as a one-size-fits-all, but really individualizing and customizing the approach, detoxifying their bodies, really talking to them about how to live a healthy lifestyle, where to incorporate meal planning, healthy eating, water, stress management, yoga and meditation, really putting it all together, looking at food sensitivities, food allergies, and eliminating certain things that are toxic to our bodies. And so what I do is I really put all of that together for my patients and individualize that approach using the best of traditional and the best that alternative medicine has to offer, putting it together and giving them that approach to be able to live life in their optimal, well self, where they can have complete health and vitality.
Terrific. That's what we're going to have to look at when we decide that we need to be very important to what's going on in our own lives as opposed
Absolutely.
to only the critical part. Thank you.
Yes, absolutely.